This is for all the pregnant mamas out there. If you are not doing these three tests during pregnancy, not only for yourself, but also for your baby, then you need to pause everything else and get these tests done right away. I'm sure you're doing everything right. Seriously, you're probably getting all of your blood work done. You're going to all of your appointments. You're getting all the checks that you need to do. You're getting all the testing that's happening. But I want to pause right there and ask yourself the question: is my OB or midwife thinking about my nervous system? Why would I ask that question? Well, glad you asked. The nervous system controls every cell, every organ, every system in the entire body, including pregnancy. So we need to make sure that we are knowing how our nervous systems are adapting to stress. How is it regulating? Is it resilient? Well, let's backpedal a little bit and talk about what even is the nervous system. Well, like I said, it really does control everything. But we really want to get a little nerdy, but I'm also going to be just simplify this. So there are two sides to the nervous system. And here's why it really matters in fertility, in pregnancy, and birth, and in postpartum. So let's walk through this. So there are these two sides to the nervous system. There's going to be the gas pedal side and the brake pedal side, which is obviously simplified. It's really the sympathetic nervous system and the parasympathetic nervous system, or what you may know it as fight or flight and rest and digest. So, how I always describe it, and you may have heard other practitioners say this, but the gas pedal is going to be if there it's utilized if there's a bear in the room. So you're going to want to fight, you're going to want to flight, right? We want to be able to fight that bear, fight that saber-tooth tiger, you're camping, whatever it may be. I don't want to get too far into that, but you could really say a whole entire story, about the gas pedal side. The other side of the balance, if you will, is going to be that rest and digest, that parasympathetic nervous system, your brake pedal. When do you want to be in this? Well, if you're just chilling at home, maybe you're cooking dinner, but your kids aren't running around, it's really peaceful. That's when you want to be in that rest and digest. You're watching a show that you don't really have to think about. That's when you need to have your brake pedal on. So I don't want to necessarily demonize the gas pedal side either. If you're giving a presentation, if you're running a marathon, if you're just doing a normal day-to-day workout, that gas pedal is going to be important, right? You want that to be on. You're at work, you need to perform, that gas pedal should be on. The minute you enter the safety zone or the rest and relax and regulate side, your brake pedal should also then turn on. So I want us to get those two sides of the nervous system down. There's also going to be two sides of your hormones as well. And know that I am really simplifying this. There are a lot more systems at play, but I want us to truly understand why this test that I'm going to talk about is so incredibly important, and why the nervous system as a whole is really important going into birth. So two sides of this hormonal pathway. The one that goes with the gas pedal is going to be the HPA axis. So when I see that bear, the bear is going to send signals to my brain, and that's going to tell me there's a bear in the room. It's going to tell my body how it does that. It's going to go through the hypothalamus, which is part of your brain, to the pituitary, and then that's also part of the brain, down into your adrenal glands, right? They live basically on the back side of your belly button, in your back, right on top of the kidney area. That is going to be telling me that I need to pump out adrenaline and cortisol and all of those hormones that are going to make me go, go, go. On the opposite side of that, the brake pedal side, with that has to do with hormones. Is you watching a relaxing show, what's going to happen is your hypothalamus goes to your pituitary, same thing, but that's then going to send down to your reproductive organs, which is big time in fertility and pregnancy and postpartum. You're going to want to have the accurate amounts of progesterone and estrogen, all of those healthy, women hormones. It also is the same in males too, but we're talking about the other side today. And so you're going to want to have those healthy hormones. That's one of the reasons why the nervous system is so incredibly important during pregnancy. We want to make sure that it's regulating and functioning the way that it's supposed to. So that's what our three tests will show us We'll get to those, those scans in just a minute. But the second bullet point that I want to go over today is why tracking your nervous system during pregnancy, it is so important. It's because of something called co-regulation. So this is one of my favorite things to nerd out about, but I hope that you'll love it too. It's that, that umbilical cord from you to your baby is not only giving the baby nutrients and oxygen and all the blood, but our hormones, literally your hormones are traveling through your blood. So, whatever you're feeling or whatever your brain is perceiving as like a bear, which, when you should be in safety, but if you're stuck on that gas pedal nonstop, not being able to access your brake pedal, your baby's learning that too through that umbilical cord, through the blood, through the hormones. They're going to match what your nervous system state is. So it's really not about you anymore. And if you're a mom or a parent, it's never really about you, right? You're always putting yourself last. But right now, when we look at it through the lens of co regulation, we're also putting ourselves last again, right? Because we're thinking about our baby, right? Or your baby. They're developing inside the womb. If they're, just taking how you're adapting to stress, they're basically getting that as their blueprint for their nervous system to develop. You want your baby to have the most regulated and adaptable nervous system, right? I know that we did for our kids, and I'm sure you do too, especially now that you know this fantastic thing called co regulation. So, what we do at our office is we use three neurological insight scans, is what they're called. And I'm going to walk you through and show you each one, what they look like. But we recommend, these scans to all of our fertility, all of our pregnancy, and really all of our postpartum patients to get these scans so that we can see how your nervous system is functioning going into birth or on the out and coming back out of birth. Well, what's fascinating about birth is you have to be able to access both the gas pedal and the brake pedal during birth. So how you initiate birth, that's the brake pedal side. It usually happens at night. It happens when you're calm. Then to really get everything going and to get baby out, you have to be on the gas pedal. Not only you, but also your baby. Both of you have to have that gas pedal response. And immediately when you pull baby up and baby is laid on your chest, that is when baby will really co regulate with you with skin to skin contact. They are really mirroring your nervous system response. And both of you should return back to, that parasympathetic nervous system state. So that brake pedal state. I really simplified that into three phases of brake, gas, brake. What happens when we get to the birth center or the hospital, like with you, your husband, your spouse, if you're having one of those births, your body will most likely stall. There's bright lights, there's beeping noises. Your body isn't used to that. And so labor may stall. So that's a gas pedal response. So, what we need to teach your body is how do I get back? How do I get back into brake pedal so that I can, I'm really ready to push this baby out and to co regulate after? So, I'm going to share my screen here and we're going to go over these three scans that we do here at our office. So, number one, this is going to be our heart rate variability scan, HRV for short. So what this does, it's going to take your heartbeats and it's going to find the variability in between each heartbeat or heart rhythm. What this is really is it's a global test to really show us how your health is. So everybody should be testing this, not only pregnant women, but if you have an Oura ring, if you have a Whoop, if you have a Garmin, if you have an Apple Watch, chances are that you're probably testing your heart rate variability from day to day. And what this test does is it not only is going to take your day to day, but it's also going to take a global measurement of just how you're functioning in life, not just today, but over several months or years. And it really shows us how you are adapting to stress that is coming into your life. We can't choose what stress happens within our life. We can't choose if the bear is in the room. What we can choose is how we take that in, process it, adapt to it, and hopefully throw it out. We don't want to store that stress. When we're storing stress, that's called subluxation. And that is why you see us, you see the chiropractor, is because we need to retrain your body how to take that stress in, process it, and kick it out instead of store it and hold onto it for so long. So this HRV, it's going to tell us how is your body battery. So this axis here is showing us your body battery. So right now, this one is starting at about 70%. So that's like if you wake up and your phone started at 70%, probably not going to last you all day. I would love to be at 100, 70%, pretty good. But let's say you're starting at 50, you're starting at 40, you're starting at 30. And then from here, right, we have this side to side balance. This is the gas, this is the brake. So we're just seeing this woman here on this visual. She is definitely on this gas pedal side here. And what that means, we want to help her. We want to help her be able to adapt to the stress in her life to really find that balance between so that her brain and nervous system can choose when she should be in fight or flight and when she should be in rest and digest and being able to access that brake pedal much easier. This scan gives us so much evidence to know how she is moving through her life, pregnant or postpartum. And being on this gas pedal side is going to limit her health and it's going to impact her baby as well. Now, the second scan that we're going to show you, and I'm going to show you when you come in, is an EMG. So what this is, it's a neuromuscular test, and we're gonna put it, up to your back, and what it's gonna show us is where you are holding any neuromuscular tension. Where are you storing your energy on the muscle system? So a lot of times when we see yellow in these areas here and right through here, this is where the adrenal glands are located. So what I'm saying about this woman that on this scan is that she has been stuck on the gas pedal for a long time that now she's kind of running out of gas. So it's like you're taking a long trip and you never stop for gas, you're going to run out and stall. And that is what is happening on this scan here. When we see all of this yellow, she's also that's what shows up as exhaustion or depletion. She is also though holding way too much tension up top here. So when you get scanned, we will personalize this exactly to your story. Chances are your scans are going to match what you're going through. This is a really cool scan because we also want to test, this on fertility patients. Maybe they're having a hard time getting pregnant. It's probably because they don't have enough gas in the tank. Their brake pedal has not been on. And so they are having to, when their brake pedal's not on, right? Your pathway of that HPG access, that hypothalamus pituitary to the gonads or the reproductive organs, it's not telling your reproductive organs to create that healthy progesterone or that healthy estrogen or to then, ovulate. So we need to get some gas in the tank here. Okay. The last scan that I'm going to show you that we're going to go over is called thermography, or thermal. And this is testing temperatures from one side to the other side and those differentiations, right? So this one is really reactive. This scan up top here is a really reactive thermal scan. And we also have a lot of blue showing up on what's called the DTG as well. We really go over these in your case in the personalized, but what this scan, it really shows us how your autonomic nervous system is functioning. So that means anything from, you don't have to think about, right? Blinking, your heartbeat, pumping blood, how are you detoxing? These are all signs of the autonomic nervous system. And so this lady here was having a lot of trouble doing just those basic functions that she should be doing. Her body was working a lot harder at those functions. And so those are the three scans that we go over in our office, and we really do feel that every single pregnant lady, woman should be tracking their nervous system. So if you want to get scanned, go ahead, DM us, call our office. We would absolutely love to see you. And we want to show you how your nervous system is functioning. It's really cool to see. And most importantly, we want your nervous system to be ready to go into that marathon that we call birth and to recover postpartum. So if you have any questions to, feel free. We have an article you can read on these scans. Feel free to head to our bio to read those or just DM us. We would love to have a conversation with you to learn more about your story, learn more about your birth plan, and really see how your nervous system is functioning. All right, I'm Dr. Devin, and I'll see you in the next video.